In order to become a doctor, you must go college first, then go to med school. So it is a 8 year training in order to become a doctor. And depending on your country, these years can be variable. Some countries just take 6 years in order to be a doctor, fully prepared and ready to work doctor. But in some countries, it's 8 years. And depending on which specialty you want to get in, this time can actually be longer until you become an attending. So, in order to become a doctor, you have to study hard in your exams and you have to show some sort of success to get into med school. And it is not actually over. Once you get into med school, you keep studying hard in order to pass your exams and fully become a doctor, fully realize your ambition. And it doesn't actually end there. After you become a doctor, after you're a doctor, you will have to read some more and you will be attending to patients, which can actually be very exhausting sometimes. But these are just downsides. Are there really all downsides about the medicine? Actually, it is not. So there are many positive attributes to the medicine. First of all, first of all, you have a paycheck. You don't actually have to think about how will I survive, because medicine in most countries, doctors are paid well. So you won't have to be thinking about your future and you won't have to be thinking about will I actually survive. So that's one. That's very primal, but it's important since we are human and we actually do have needs. So other aspects, you actually have the ability to manipulate someone's life in perhaps in second. Like if a patient is having MI, myocardial infarction, and you take them to coronary angiography lab and you reserve them, you take that embolism and you widen the vessel so the patient is almost good to go to home. In seconds, you actually save the patient from a life-threatening situation, and it's very fulfilling. And most of the people will not be able to do something that is this direct to manipulate others' lives. It's some kind of power actually, and it's some kind of success. It's a very big success. It's a very 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 enormous amount of success, and it gives you some kind of pleasure to be able to do that. It makes you very successful, and it makes you feel very successful. It's actually very great, and the thing you feel when you actually are a part of the team and leader of the team that is saving a human's life, it's very fulfilling for you spiritually. And in medicine, we actually have a path in our lives. Some people kind of feel lost. Some people feel lost because in their lives they don't know what to do and they don't know how they will spend their life, how they will die. So many doctors do actually know how they will be spending their lives. They are actually preparing their lives from a very early stage, perhaps even before they graduate from the med school. They've been preparing for the life. So just attend to med school, finish it, and get into a residency and finish that and become attending. So you actually kind of get to live your life after you're an attending. This profession do have many, many, and many advantages. It of course have downsides because trading time for money actually is what you're doing in the medicine and in the most of the workforce. Actually, we do trade our time for money, and that kind of takes control away from you and gives the people who actually own the place, perhaps own the hospital, or perhaps own the health system. And it's one of the downsides. And I really would like to see this change and actually do doc I really would like to see doctors take the power in the health field. So they are not totally in control, and this is sad. They are actually paid well compared to other professions. They work hard. They're actually pretty smart in order to get into med school and finish that and actually manipulate someone's life. You have to be really smart, and most of the doctors are very smart, in my opinion. So it's very fulfilling. It has these downsides. The profession is very good, but jobs can be exhausting and sometimes, because many physicians do suffer from the burnout. They just work so hard, study so hard, and they're just like, boom, burnout. I just can't take it anymore. But many physicians actually do love their job, and they really enjoy doing their job. They really do enjoy doing their job, and they love their job. They love their profession perhaps more than their job, but they actually love their job either. And I think this is very important for physicians to know also. They can be in control. Government or the other doctors, perhaps the hospital owners, don't have to control you because you are the main provider of the system. So you actually do have the power, but you don't know it yet. That is my word to physicians. Just grab power. I think just grab power and just start changing the health system, which will benefit you more and benefit the patient more actually. So it can be even greater. It can be even better. So the med school is actually fun. I think I had so much fun when I was attending to med school. It was really fun, and some of years are still the best years of my life. So I actually love it. The times I spent there, I had very good friends there, and we were kind of intimate. So we all kind of had to work hard to our exams, and we used to go to library when the exam is close and we'll be attending the exam in a short amount of time. We all went to library, so we had these breaks and we will grab a coffee and just start throwing conversations, and it was very fun actually. We all laughed, we all had so much fun, and then we returned to studying again. We had a way and we had a path, and it made it so beautifully fulfilling. I don't remember, except perhaps except for the first half of the med school. It can be annoying because the clinical rotations didn't actually start yet, and you most of the time you remember, and you are being responsive, and you are being responsible for the actually getting that information in your head, because you will have to pass your exams. If you fail, you will not be attending to clinical trials and clinical stages of the med school. And I didn't enjoy as much as I did at the clinical side of the medicine. And this is actually what you do when you graduate from the med school. So the clinical rotations were actually very fun. I kind of love them. I don't care yet. Yes, we worked hard, but we actually did play hard either. We actually did go to movies and do all some sort of things. And I remember having always kind of having spent my time outside of the house when we got out of the school. We always had these things which kept us busy in our social life, and it was very good, because when you're surrounded with actually intelligent people, it's easy to have fun. It's easier to have fun, and I think med school is one of the funniest you can find in the realm of the schools, colleges, and universities. It's very cool actually. And when you graduate, you're a doctor, you have some sort of prestige and social status, and it's also cool. So if anyone wants to get into med school and actually become a doctor, here's what you need to know. You have to be prepared for some exams which will actually be hard in your life, but not so hard but not so hard. It's all possible. It's all possible to finish med school in the way you never fail in your exams. It's all possible, and it's actually cool. And you will have to know that after you graduate, you'll be attending to patients. Since you will be most likely, if you're a radiologist, it's a different kind of thing. But most of the specialties, you will be attending to patients, and being actually able to deal with people is hard. Dealing with people is hard, and dealing with sick people is harder, and you should know that. But you will have some kind of nice income, and you will have this impact on the world, and this impact is actually big because you directly influence a person's life. And if you practice medicine right, it's very good. If you practice medicine right, you will be helping this person in a very big way, and you will have a major shift in their life. And it's all possible because of you, so you will be very fulfilled. And med school is actually very great for meeting nice people, meeting cool people, and having lots of fun while you are studying medicine. And it's good because you'll be attending to college or university anyway, so these people can make your journey very much better in my opinion. And they actually are smart, so you don't get bored a lot because they're smart. You always kind of find something to be enjoyed. It's very nice. So, and what you should actually know is being in a medicine field is not a one-way ticket. Many doctors do actually do other stuff aside from their job, and I'm one of them. Many doctors are intellectually capable enough to do something, and perhaps many of the people that are watching video will be actually doing other stuff in their life, and it will be good for them, and it will be joyous and enjoyable for them. Very, very, very enjoyable for you. So, like other things, you can have these hobbies with you, and you can have actually other source of income depending on your specialty, because some specialties really do need to have most of your attention in your life, and you can't actually focus on another thing. But in some specialties, like medicine specialties, non-surgical, and in some surgical specialties, you can also focus on your life aside from the medicine. Most of the non-surgical specialties are actually good to go. You can focus on many other things, and you can focus on many other things aside from the medicine. So it gives you some sort of time control, because you will have to finish your lessons and examinations, prepare for the examinations, perhaps in some short times, and you will be learning how to manage your time in the med school, and it's great. So just remember this: having a huge impact in a human's life is very fulfilling. You do this right, and you will have a joy none other non-medicine practice can bring to you. It's very direct, and it's very influential on a human's life. And if you are into directly influencing a person's life, I think the medicine might be right choice for you. So I'll see you in the next video, and take care of yourself. Goodbye.